Watery eye discharge versus goopy eye discharges in babies and kids. When to worry? Stick around. We are going to talk about the most common kinds of eye discharges in children, from the benign ones to the ones that should warrant more medical attention. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician who takes an integrative and holistic approach to your child's health by addressing the root of the problem. I see thousands of families like you who want more than a Band-Aid to cover up their child's health concerns. If your child has had any kinds of eye discharge, you know that the top of the questions that I get asked by parents all the time is this normal? Is this contagious? And how do we need to treat it? First, we're going to cover the most common kinds of eye discharges in newborns, meaning the first 2 months of age. Then we're going to talk about the eye discharges in older kids and that you will see the most. Seeing crusty or watery eye discharges in your baby can be very worrisome, and understandably so. The most common and benign reasons that babies may have eye discharges or watery eyes in the first few weeks of life is what's called lacrimal duct stenosis, or simply this translates to narrowing of the tear ducts. Babies are born with very narrow and small tear ducts. And these, by the pure nature of how small they are, often get blocked or clogged by debris or dried eye discharges. As a result, your newborn may have asymmetric watery eyes, yellowish discharges in one eye, tears pooling in the corner of one eye or both eyes, and sometimes the tears can drain down one side of the eye, as you can see here. With time, this will resolve on its own as babies grow and the tear ducts expand in size. I recommend using a warm towel or cloth for compress and gently massage the inner corners of the eye twice a day to help open up those blocked tear ducts and allow for better drainage and for resolution of the symptoms. Medicated drops are not necessary for this condition, and because this is a structural problem, even using breast milk is not warranted to solve the underlying issue. The best thing is to allow time for your baby to grow out of it. When to worry? If there is redness or swelling around the eye, or yellowish or thick green eye discharges, or other symptoms like fever or thick nasal secretions, there may be something else going on, and that would be a good time to check with your pediatrician. By the way, if you found this video helpful, please give it a like and subscribe to get notified for new videos. Now, in toddlers and school-age kids, eye discharges are common. They can be caused by allergies or infections like viruses and bacteria. So when it comes to eye infections in kids, like pink eye or medically called conjunctivitis, I see way more viral infections than bacterial eye infections. It may be hard to tell which is which. They are both itchy and uncomfortable, but usually the bacterial conjunctivitis, there is discharge, and it's definitely thick, greenish, yellowish, and it's ongoing throughout the whole day. This is different from viral eye infections, which causes clearish eye discharge, and the discharge will be less, and I would say crusty, probably mostly in the mornings or after naps. Both can be contagious, which means that it can start from one eye and then spread to the other. So it is important to get evaluated by your pediatrician as soon as possible. I usually treat bacterial pink eye with a topical antibiotic eye drop. If your child has a bad cold with lots of nasal secretions or drainage, he or she may also have eye discharges, specifically upon awakening from a long nap or in the mornings. So this is what I call a cold in your eyes. Simply when the nasal secretions get so much that it just overflows into your eye. It is not that the eyes are infected, as in this is not pink eye, but you would see this when the sinuses are full of secretions, and then since the nasal cavities are connected with the tear ducts in the eye, these can fill up too, and you can see it when your child's lying down. Allergic conjunctivitis is basically inflammation of the conjunctiva due to allergies. In this case, it always involves both eyes. And there's also itchiness and sometimes clear eye discharge. This is common during allergy seasons and change of seasons throughout the years. Your child may have also other allergy symptoms too at this time, like itchy nose, watery eyes, sneezing, and hives. I usually treat this with a topical eye drop that calms down the eye discomfort. I also recommend a steamy shower and some warm compresses and even an oral antihistamine if needed to comfort the eyes from the itching. Now in this video, I am not going too much into treatment of conjunctivitis because it is really dependent on the case-by-case evaluation. But I hope that you now have a better idea of what makes an infectious pink eye different from an allergic eye condition and how to tell if your baby has tear duct stenosis. And if the symptoms are getting worse after 2 to 3 days, please check with your pediatrician on the recommendation for treatment. Thanks for tuning in. I hope you walk away with a better understanding of common pediatric issues at the root of the problem. At my Las Vegas pediatric practice, my team and I take a holistic, personalized approach to your child's health. Check out our website at www.littlerootspeds.com for free resources and blogs about holistic care and how we can work together.